Very good evening, friends. Now you are watching Surgical Educator RKT. Today we are discussing very important topic, pancreas. Infection of the pancreas, either acute or chronic. Pancreas is a very long chapter, so we have to make 6 to 7 video from surgical anatomy, physiology, pathogenesis of pancreatitis, etiology, clinical features, investigation, scoring system, chronic pancreatitis and pancreatic tumor, and surgical correction of pancreatic tumor. So today we are discussing about inflammation of the pancreas. Two type, acute or chronic. Acute inflammation is due to certain reason, but it is reversible, and chronic inflammation is the permanent progressive damage to destruction in pancreas. Always remember, diagnosis of acute pancreatitis is the biochemical, and chronic pancreatitis it is mostly radiological, because in chronic pancreatitis there is a tissue destruction occur. Now we are briefly discussing about surgical anatomy and physiology. Pancreas located in the C loop of second part of the duodenum and extended up to hilum of the spleen. It has three parts: head, body and tail. Tail is very close to spleen. So when we going to do splenectomy, always take care not to damage iatrogenic damage to the pancreatic tail. Pancreas is a exocrine and endocrine gland. Pancreatic juice is highly irritant juice of GIT. It has enzyme, proteolytic enzyme, amylase, lipase, elastase, etc. Very important role in digestion. Very important point to note that common bile duct and main pancreatic duct fuse together when it entered to ample of water, the major papilla. Sometimes there is a accessory pancreatic duct. It is also known as central duct. It is a minor papilla. This is the diagrammatic representation of pancreas, duodenum, gallbladder, its and CBD. CBD and main pancreatic duct fuse together and form a hepatico-pancreatic papilla, which drain the pancreatic juice and bile in the common channel. It is surrounded by sphincter of the OD. Now we briefly discussing about pathogenesis of inflammation of pancreas. Whatever the reason, main thing is that intracellular conversion of trypsinogen into trypsin with the help of enterokinase enzyme, causing destruction of acini. This is the main pathology. Either pancreatitis may be due to oversecretion of pancreatic juice and improper drainage, either by stone, stricture, and any congenital abnormality, other thing, and vasculitis. This is the main pathology of pancreatitis, is the intracellular conversion of trypsinogen, which is a highly proteolytic enzyme that causing autodigestion of the pancreas. Now we briefly describing about the causes of pancreatitis, etiology. Major cause of inflammation of the pancreas can occur by the gallstone disease or alcohol. 80% causes of pancreatitis is either alcohol or gallstone. Gallstone hypercalcemia, hyperparathyroidism, rising level of triglyceride. Triglyceride also plays very important role in the pathogenesis of pancreatitis. If triglyceride level more than 1000, that can cause inflammation of the pancreas. Other cause, some viral infection like cocci virus, cytomegalovirus, cytomegalovirus, and mumps virus. Some congenital conditions like annular pancreas and pancreatic division. Pancreatic division is a congenital malformation in pancreas when ventral and dorsal wall failure to fuse embryologically. So the main drainage of pancreatic juice through accessory duct, not through the main pancreatic duct. Diameter of accessory duct is very small. So improper drainage of pancreatic juice occur, then causing autodigestion of pancreas. Some iatrogenic conditions. In case of gastrectomy, in case of nowadays ERCP, nowadays ERCP is very frequent, doing investigation as well therapeutic condition in case of CVD pathology in removing CVD calculus, in case of a stricture, sphincterotomy, in case of ERCP. Nowadays the most common iatrogenic cause of pancreatitis. Certain drugs like thiazide diuretics, furosemide, steroid, estrogen, 5-fluorouracil, azathioprine, these drugs can cause pancreatitis. Now we discussing about the clinical feature of pancreatitis. There are certain sign and symptom of pancreatitis. Symptom. Pain is the cardinal symptom of pancreatitis. Pain in epigastrium. The character of the pain: sudden, shooting, severe abdominal pain with nausea and vomiting and radiating towards the back, because pancreas is a retroperitoneal organ. Always remember, it forms the stomach bed. And the patient feel comfortable in sitting and leaning forward. Nausea and vomiting may be associated. Patient looks dehydrated because fluid sequestration or third space fluid loss is seen in pancreatitis. Patient may be in shock. Patient, in case of acute pancreatitis, maybe came in emergency in a shock, pallor, hypotension, tachycardia, and difficulty in breathing, because the pancreatitis can cause bilateral pleural effusion, ascites, and ultimately ARDS, adult respiratory distress syndrome. Some sign: abdomen may be distended, there is a tenderness in the epigastrium, but important thing is there is a no rebound tenderness as we see in acute pancreatitis. Always remember, reason because pancreas is a retroperitoneal organ, so rebound tenderness not found in a case of acute pancreatitis. Certain sign. There are three important signs. First is Cullen sign, ecchymosis, present periumbilical. It is important thing. Always remember, Cullen sign discovered not in case of pancreatitis, in the first case of rupture of ectopic pregnancy. The Gray Turner sign, there is a discoloration